Welcome to Morning Infusion with Dr. V, where we are intentional about connecting you with other entrepreneurs that have overcome and want to provide value to the audience. It's Dr. V here, where our coaching program teaches nurses to work from their computers anywhere around the world, making money and owning their own time. So today we have with us the amazing Michaelle Holbrid. So tell us a little bit. So give us your bio, because you are just simply amazing. So go ahead, give us your bio.
Good morning, Dr. V, and thank you so much for having me on your show. My name is Michaelle Holbrid, and I'm a family nurse practitioner, and I specialize in both women's health and primary care. I'm also the CEO and founder of NPOnCall, which is an after-hour, completely virtual clinic that I provide services for the patients here in the state of Oklahoma. I am passionate about two things. I love empowering women with education so they can make informed decisions about their health. And I am a huge proponent, advocate for preventative screenings, especially in the African American population, due to how we are disproportionately affected by every chronic disease and cancer. So if we can get the preventative screenings in our communities and find conditions and illnesses early, better treatment options, better outcomes, not poor outcomes, and overall a better life for our African American patients. So I am very passionate about those things.
I love it. So now tell me a little bit about, my first encounter. I just want to say my first encounter with women's health, and where it was, a tragic situation, was a young lady. She was probably in her 40s at the time. She never, ever went to the doctor, like to get her yearly pap smears and things of that nature. And she ended up having cancer, and she ended up dying and leaving several children behind. Yeah. And so tell us, what are some of the statistics behind women's health?
Let me tell you, in terms of women's health, and I'm so glad you brought that point up, because the Well Woman exam, the most dreaded exam for every woman, it's not only African American women, it is women, period. When I step into the room to do the pelvic exam, the eyes are rolling in the back of their head. They're so upset, and I literally come in hot. I'm excited, and they're looking at me like, what's going on? And I tell them, listen to me, this exam can actually save your life. I am telling you, in terms of stats for African American women, and I work in Oklahoma. So in terms of African American population, we don't have a lot of African Americans in Oklahoma. We do have a representation, but I don't see a lot of African Americans that come in for preventative screenings. The one or two that I see, because they found me on Google, and now they're starting to come in for their exams. But our African American women are being affected by cervical cancer. I'm telling you, cervical cancer, breast cancer are some of the top. Cervical cancer, breast cancer, and colon cancer are the top cancers for African American women. And it is very sad, because it is truly the lack of screening. Imagine coming in for that 15 minutes of Well Woman exam, where you do your breast exam, your pap smears. I tell women all the time, this exam saves lives. In the last 8 months, I have been able to locate and palpate 10 breast cancers.
Wow.
10 breast cancers in the last 8 months. And we have been able to find dysplasia and high-grade HPV, so we can initiate treatment. So getting the awareness out there for our African American women, so we can have better outcomes, because literally by the time the cervical cancer is found in the African American women, because they have neglected those screenings, it is in late stages. And so the treatment options are very limited.
So tell me, because some of the people in the audience may not know what dysplasia and HPV is. So
Okay.
explain to them what dysplasia and HPV is.
HPV is the human papilloma virus, and the human papilloma virus is the virus that, if left untreated, can lead to cervical cancer. And the only way of finding cervical cancer is through your pap smear, is coming in for that annual screening and getting the actual pap smear where we obtain a sample from the cervix, send that off to pathology where they're looking for abnormal cells. If those cells come back abnormal, sometimes it comes back and it's ascus, atypical squamous cells of undetermined significance, meaning they don't know quite exactly what it is, but it looks suspicious. But then we have some pap smears that come back with low grade, like mild dysplasia. That is that they see the HPV virus cells there, but it's in low grade. It is not high grade, meaning it's mild case. So we follow those things. By the time you get to high grade HPV, something needs to be done. We're taking closer look at the cervix. We're taking biopsies, and then we're initiating treatment early, because if we initiate treatment, we are preventing the progression of cervical cancer. So the only thing we can do to find the cervical cancer is to have those annual PAPs.
I love it. I love it.
Find it.
I love it. So now tell me, I'm going to transition just a little bit into what your profession, what you do as far as NPOnCall. So now you work as a nurse practitioner in a women's health clinic, I'm assuming?
I do. I work as a nurse practitioner in a women's health clinic. And actually this has been probably the last year. Before that, I spent 2 years in primary care as a nurse practitioner. And so nurse practitioner on call, or NPOnCall, kind of was birthed because of my love and passion for women. It was created with women's health need in mind. I solely created NPOnCall because of my love for women, and I wanted to offer something for women. We were towards the end kind of the lockdown in the pandemic, and people weren't getting care or health. And my concern was, what's happening to my women? What's happening to my girls with the UTIs, the vaginal infections? What's happening to my girls with the anxiety? I wanted to create something specific with their needs in mind. And NPOnCall was birthed out of that. As soon as I launched that, which has been about a year ago, I received a phone call with a job offer in women's health. And I was like, look at God.
I love it. I love it. So so your business is on call after hours. But during business hours, then you're, actually in the clinic.
I am. I actually in the clinic doing all the well woman exams, all the breast exams, everything that pertains to women and pregnant moms. So I do OB-GYN.
So now tell me, when did the passion for women, like, did you have a particular patient or you just love women?
I'm a woman, number one. Boom. There you go. I'm a woman, number one. Number two, I have 3 sisters. Number 3, I birthed 4 daughters. I'm a woman's health. I'm a woman's advocate. And then I spent 7 years as a labor and delivery nurse. I never did med surg. I never did anything. When I went to nursing school, I wanted to do labor and delivery. That just was my focus. I think it stemmed from my very first pregnancy, and that passion and the calling to nursing came. And I knew that I wanted to be in a particular specialty, and it was labor and delivery. And God was faithful and allowed me, straight out of school to get into that specialty, which you can't typically do. Right. That's why I'm telling you, it was a God thing. My life, God. And so I spent 7 years as a women's health labor and delivery nurse, and just fueling the passion for women's health.
So you went back and you went back and got your FNP, and then you started the FNP on call. So what are some of the services that you offer for
for my after hours. Literally, I do after hour. The one that I push is the after hour urgent care. So if symptoms occur after 5, which they typically do, because for most of us, we're professionals and we're extremely busy. So we can kind of go through our day and maneuver. But after 5, when you're leaving from work and you're like, oh my goodness, I have had this UTI symptom for at least 3 days. I have forgotten to call the doctor. I don't have the time. That's when I come in. So I deal with UTIs, vaginal infections, sinus infections, ear pain, upper respiratory, COVID symptoms, anxiety, depression, mental health, illnesses. I deal with, and the funny thing about it, although NPOnCall was created with women's needs in mind, when I started seeing a lot of the women on NPOnCall, of course they wanted me to see their husbands. And so that was the big thing. Can you see my husband? And so I opened NPOnCall, where I see and I treat the entire family. I try not to go too far on that pediatric side. No.
You're either 4 Ps or you're not. And
it's a no for me. It's a no for me. It's a no for me. So, but I see women and I see their husband, and literally offer, a variety of services. I also offer primary care services. I work closely with patients who are dealing with chronic disease management, hypertension, diabetes. That's another one of my passions, is diabetes. I ran a diabetes clinic for African Americans for over a year and a half. I actually developed a program and ran a clinic for over a year and a half in the African American population. It was very, very effective because we had a team-based approach. So diabetes is another one that I'm very passionate about, and I love taking care of patients with diabetes, type 1, type 2, of course, in your gestational diabetes. So I also do advanced practice provider courses. I have had a lot of friends and students, because I also preceptor as well, nurse practitioner preceptor, who reach out to me after, as soon as they get on the floor, and they're like, okay, no, this women's health thing, I don't like it. So they will shoot me, text messages, and please, I need your help. I need your help. So I started developing courses for advanced practice providers, especially in women's health topics and in diabetes. So I offer a variety of services.
I love it. I love it. I love it. Now you offer that in addition to, you're doing a lot. I love it. I mean, you're gonna
yes.
I'm here for all of it.
Yeah.
And, we were talking about the pediatrics and the women's health, and how you don't want the pediatrics, and I used to be an ER nurse, and so we don't want the delivering of the babies. Like after the baby get out, then we're good, right?
We're good.
We like taking care of the babies, but that whole process of getting them here, y'all can have that.
It is.
And it's amazing how, different people are like, nah, I won't do that. So I love it. So now tell me about, do you experience any, when it comes to how you transition the client, do you have any that are skeptical about coming to NPOnCall, or they really enjoy it? I would really enjoy it, but that's just me.
Here's the thing. Telehealth and telemedicine got really big during COVID. Mm-hmm. And I'm a businesswoman, and as with any business, as you know, when you first start business, we all wanted to hit 10,000 patients in the first month. Unfortunately, that's not how things go. You have to, just like your weight, if you're not consistent, you're not going to see results, period. So amen. So the last year with NPOnCall, I've been open for a little over a month. So the last year of NPOnCall, it has been hard. It has been hard trying to get out the exposure of NPOnCall out there and tell people the services I provide and what that nurse practitioner advantage is, having a nurse practitioner. Because we don't only, as a nurse practitioner, I don't only triage nurse, I can literally what? Evaluate, assess, diagnose, prescribe. Boom, you have it all in one package just by picking up the phone. So if symptoms occur literally after hours or on the weekend, NPOnCall is that healthcare solution. As soon as people use the service one time, they're hooked.
Mm-hmm.
They're literally hooked. But it's getting more and more people to use the service, because once the service is used, I'm telling you, the patients that I've had for the past year, they have used the service multiple times, because once you use it, it is so convenient.
Right.
You do it in the safety of your home, your office, your dorm room, your tent. You can do it by the lake while you're in your car. And it's getting people to utilize the service.
I think that's one thing, that's one of the key factors in it, is that I think, time versus money, right? And people are like, well, what's more important, time or money?
Yes.
Your time is more important,
Sure.
obviously, right? Because if you have $25,000 and you have a disease that you need to cure and it costs you $25,000, then you're going to take that $25,000 and you're going to cure that disease.
Yes.
Unless you just want to die today, right? I mean,
Yes.
So it's time over money. And so I will pay for convenience.
Correct.
Before, anything, because then that decreases the time that I have to do a thing. Yes. And then you can move forward. It's just like having a housekeeper or doing those services like Walmart, of course, those services like that, those services are super important. So I love that. So now tell me, now when you said that you're a businesswoman, how did you become a businesswoman? Where'd that come from?
Trial and error. Listen, my motto is, you only live once. You only live once. What I'm trying to show my children is, as a woman, you can do it all.
That's right.
You can do it all. That's what I'm trying to show my children. And I'm a woman, and I'm an African-American woman. So according to people, I've got two things against me, but actually those two things are for me. So I've always taught my kids, if you're going to do something, you better do it. Come correct with it and be at the top of your game. Boom. So I have seen other business women out there starting and doing their thing, and thought to myself, why not me? Why can't I do that? And so I have a passion to help people. That's my calling. And I wanted to provide a service, because it's not about the money. It's not about the money. It's literally about caring for other people and offering them a service. Because patients who don't have insurance, NPOnCall, great way to access care. It's a way of accessing care in the areas where they can't access care as well. So literally, I've been a businesswoman for about a year. And so with any business, there's trial and error. I'm building a business. I'm building an empire. I'm building something to show my children, Mom can do anything. I can do anything. And that is solely based on God, period.
Period.
Stranger to failure. I can't fail with God on my side. I can't.
Now that, because let me tell you, that's exactly what I said yesterday. I was out with a friend yesterday, and I said this. I said, God's word does not return void. God said that he will do exceedingly abundantly above more than you could ask or think. God said that without faith, without works, faith is dead. And then without faith, it's impossible to please him. Yes. So you have to have the faith and you have the works. And then he will do, and his ways are higher than our ways. His thoughts are higher than our thoughts. And at the end of the day, he will do it for you.
Will do it.
And so I'm glad that you brought that up. Now, one of the things, one of the reasons why I asked you about that is because when we go into nursing school, we're never taught how to be in business for ourselves.
That's correct.
And we have to be very intentional about hanging out with people who are, and we were just talking on our team meeting this morning about how we need to be very intentional about hanging out with people who are doing the things that we want to do, seeing the possibilities and moving forward with those possibilities.
Yes.
So I love the fact that you are just moving forward and you have created this space that creates for women, right? Because women's mortality is huge.
It's high. It's high.
And people don't understand, like they don't even know that, right? And I didn't even know that when I first became pregnant, with my child. But
Correct.
and that was 25 years ago. Yeah, she's
Yes.
25. Almost 26 years ago.
I get it. Me, 28. I had no idea that me as an African American woman going in to give birth, I was 4 to 5 times more likely to die in childbirth. Had no clue. If I had a clue, I wouldn't have done it 4 times. No, with those risks, I would not have done it. But I mean, Dr. V, the amount of women that do not get prenatal care, African American women,
Ooh.
let's talk, I mean, they don't get care. It's the lack of care that increases our risk factors for maternal morbidity and some of the things that we're facing. So that's why it is so important for us to get the message out there.
And so I think that it is like all women. Like there's a bunch of women that I have seen, African American and otherwise, who just do not get care. And I am just like, how does that work?
How does it work? How does that work? Literally, they show up when it's time to give birth at the hospital. There's no, I mean, you literally have no, there's nothing. We have no prenatals. We have no history. We know nothing except for this mom is coming in and she's going to deliver. So this mom is at risk for postpartum hemorrhage, abruption, so many things. And so it's a scary situation. It is such a scary situation.
It is. So I'm so super glad that you're doing what you're doing as it relates to that. So I wanted to explore a little bit about, if you don't mind, and you can tell me whether I need to bag me up if I don't need to, but like, personally, like you went through some struggles in life, but you have forged forward. And I think that those stories, kind of how you have just forged forward is huge. Sure. So do you mind talking about that?
No, I don't mind talking about it at all, because like everything that I've been through in my life, I'm going to use a word, has catapult me into purpose.
Mm-hmm.
Has catapulted me into purpose. So I was in a very bad marriage for 13 years. Had my 4 children with my previous husband. Very, very bad marriage. Ended heartbreak and with nothing. I was nothing. I had nothing. I had the desire to be a nurse and couldn't be. And the Lord brought somebody into my life who saw brokenness. I was literally nothing. Took me and my 4 children and asked me what it is you want to do. And I told him, I want to be a nurse. I have to make a difference. And my current husband, did everything. He said, I will do everything in my power to make sure that happens for you. And for the last 15 years, he not only said it, but he put that action to it. And I would not be here, number 1, if it wasn't for God, but number 2, for the love and support of a wonderful husband who literally thinks I can do whatever it is I want to do and has supported this vision and has been literally the support for everything that I've done in the last 15 years. I've also, on this journey, I lost my mother from stage 4 glioblastoma, which is a terminal brain cancer. Now, my mother, African-American woman, my mom did everything correct. She went every year. She got her mammogram. She got her PAPs. She was always at the doctor's office making sure everything was good, and still developed brain cancer. Unfortunately, it's not a cancer that you can screen for.
Right.
But she was diagnosed with brain cancer. I think I was 1 month into my nurse practitioner program, and having to press through, going through cancer treatment with her. I was her primary caretaker for the 9 months that she was alive. I believe that also built the foundation of how I practice. That terminal brain cancer was extremely difficult. And I was allowed to take off 9 months from work and solely focus on caring for my mother in those end stages. I believe that is what has formed the nurse practitioner that you see here today. I was blessed to be her caretaker. I was blessed to care for my mother. And she did receive healing, not the way that her kids and her husband would have wanted her to receive healing, but she did. She is now in heaven. And so pushing through that was very, very difficult for me when I lost my mother. And I know that you have just experienced that as well. Very, very, very difficult. After my mom passed away, my second daughter got hooked on drugs. And and pushing through, I literally thought I was going to lose my mind. I thought I was going to lose my mind. So going through those things. So the person that you see here today is not peaches and roses and cream. I've been through something. I have been through something. It has made me who I am. It's catapulted me into destiny and into purpose. So when I tell you, you can make it despite what you've been through, because I've lived it. I've lived it. I've been through it, and I'm still standing. I am still pushing, all because of the grace and the mercy of God that is operating in my life.
There's 2 things that I want to say about everything that you just said. Number one, I think that there are a lot of men out there that don't understand, and they have no idea that if they just supported their woman,
Sis,
let me tell you, their lives would be exponentially better.
absolutely.
That's number one.
Absolutely.
The second thing is, I love how you stand in gratitude. Gratitude is extremely important. Why would God give you more if you're not thankful for what you already have?
Yes.
Amazing.
Yes.
You display it amazingly. Like, I have admired you from the first time I've seen you. And so I am just so super excited about where you are going. This has been an amazing podcast.
Yes.
And I am just so super excited about it. But so tell them where they can find you. It's only in the state of Ohio, unfortunately. Oklahoma. One of them old states. Okay.
One of them old states. I am in the state of Oklahoma. You can find me online at www.NPOnCall.org. I also have a Facebook page. You can follow me on Facebook. You may not be in the state of Oklahoma, but you might like what I am doing. You want to follow me on Facebook? Please do. Follow me on Facebook. If you have a question, if you have any concern, I'm one of those people. I'm going to help you. I'm a sis. I'm going to help you. You can reach out to me. Facebook, TikTok. Follow us on TikTok, and on Instagram, on LinkedIn. Those are where you can find NPOnCall. I'm on all of those media outlets. So please follow us. And then, of course, for those in the state of Oklahoma, if any symptoms arise after hours, just simply pick up the phone and dial 918-233-5093. We are your after-hours healthcare solution.
Now, give us that number again. Give us the number again.
It is 918-233-5093.
Sweet. So thank you for showing up. So we will be having our master class September 6th from 6 until 8 p.m. for you to learn how to be a nurse coaching consultant,
Okay.
working less and owning your own time. I ask that you like and share this podcast.
Okay.
And you guys have a phenomenal rest of your day.